Welcome to the Pain Truth program. Let's talk about opioids and pain medications. Chronic pain affects over 1.5 billion people worldwide, for which painkillers such as opioid medications are often prescribed. Opioids are a class of drugs that include heroin, fentanyl, and pain relievers available by prescription such as hydrocodone, codeine, and morphine. Most people get at least temporary and partial pain relief from opioids, and quite effective when prescribed by a physician for acute pain, such as after surgery. However, the potential risks versus benefits of their use for people with chronic pain continues to be debated. Studies have unfortunately shown that long-term opioid therapy doesn't result in long-term improvements in chronic pain or quality of life. Other than the several side effects such as constipation, fuzzy thinking, and addictions, there's another opioid side effect that doesn't get enough media attention, and that is opioid-induced hyperalgesia. Yet several books and papers have been written on the topic. Opioid-induced hyperalgesia, or OIH, is the phenomenon of increased pain sensitivity as a direct result of long-term opioid use. In other words, opioids may actually be increasing nervous system hypersensitivity, meaning ironically worsening what we're attempting to treat. In simple terms, OIH happens when artificial opioids, prescribed or illegally consumed, decrease the natural opioid production by the body, worsening pain intensity. Therefore, people often need to be prescribed more of the artificial opioids or other painkillers to experience the same level of pain relief and improved mood. If you've been on opioid medications for several months and don't see any improvement in your overall condition, then be honest and ask your doctor, could these painkillers be actually making my pain worse? And how can I wean off them? We obviously don't want your pain to worsen when you get off your medications. So, what does the research say happens when people are weaned off them? In a study published in the journal Pain, titled Changes in Pain Intensity After Discontinuation of Long-Term Opioid Therapy for Chronic Non-Cancer Pain, concluded, pain intensity following discontinuation of long-term opioid therapy does not, on average, worsen for patients and may slightly improve. The key word here is on average. There are some who actually get dramatically better when they discontinue all opioids. Sadly, opioid tapering off programs aren't often successful, but certainly possible with proper medical supervision. Physicians are truly stuck between a rock and a hard place. On one hand, they're obligated to help patients who are suffering from severe and often intolerable pain. On the other hand, they must calculate the potential risks and side effects for that individual patient. Do patients and doctors have any other options in the long term? Yes. So please continue to watch this video. There are two basic types of opioids: exogenous artificial opioids and endogenous natural opioids. Exogenous opioids are made externally, meaning not by the body, but in a pharmaceutical lab and given to you by a pharmacist. So we will call them artificial opioids. Endogenous opioids are made by the body, and they include chemicals such as endorphins. We will call these natural opioids. What if focus was shifted away from the exogenous opioids to endogenous opioids, meaning shifting from artificial opioids to body's own naturally made opioids? Fortunately, there are several options for releasing your own natural opioids in order to help lessen the need for artificial opioids or other pain medications. Natural morphine, such as endorphins, are produced during various activities, such as intense physical exercise, participation in enjoyable life activities, social laughter, social activities, social touching, and listening to music. Although there are several options, there is no single activity outside of laughter that consistently produces endorphins for everyone. We will now discuss 5 activities that may help you release your natural opioids. But it must be said that this will only happen if the activity is actually pleasurable to you. Let's begin with intense physical exercise. Several animal and human studies have shown that natural opioids may play a role in pain relief that is often produced by exercise. People who participate in regular physical activity may still experience various aches and pains, but they recover better and are less likely to develop chronic pain in their muscles, bones, and joints. Instead of focusing only on passive treatments such as medications or manual therapies for pain relief, you may focus on getting a daily dose of enjoyable physical exercise. You may dance or take up martial arts classes, walk to work or jog in the park, join a pole walking group, or start weight training exercises. Ask a physical therapist what might be right for you. Now let's talk about enjoyable daily life activities. Although many people are aware of the benefits of exercise, it's quite challenging to stick with a program, especially when you have pain and fears of worsening your symptoms. Perhaps instead of focusing on exercise, which some find intimidating, you could focus on returning to meaningful and joyful activities of daily living. Studies show that accumulating just 30 minutes of activities throughout the day for 3 months is beneficial to improving pain and function. To stimulate natural opioids, you may do your best to return to meaningful and joyful life activities such as walking the dog, yard work and gardening, cooking and baking for the family, cleaning the house, especially if you enjoy the satisfaction of a clean house, short duration grocery shopping. Get off the bus a stop earlier and walk. And park the car at the farthest parking spot and enjoy the short walk. This sign should be up at all parking lots. This is the farthest parking spot. It is strictly reserved for those who wish to walk a little and feel good. Let's now discuss laughter. Laughter is a kind of tickling of the mind. Charles Darwin. Laughter naturally happens during enjoyable social interactions, which makes it the single best method of releasing natural opioids. You may go to a playground with a child and laugh along with the kids. Invite friends over to watch a comedy movie 1 or 2 times a week. Or laugh out loud, LOL, for 1 minute for no reason. For example, once at 7 o'clock in the morning and once at 7 o'clock in the evening. Go to a comedy club with someone or even alone. Again, regular laughter in a social setting releases the best natural opioids. If you don't care much for laughing, then consider participating in some social activities. There are several studies that show a link between loneliness and chronic pain. It appears that loneliness may increase the risk of developing chronic pain, and sadly, those who develop chronic pain are more likely to become socially isolated. Since artificial opioid medications stop the production of natural opioids, people on long-term opioids may lose pleasure from social interactions and become uncomfortable with social relationships. To stimulate natural opioids, you may seriously consider giving yourself a daily dose of some form of social connection. You may join a community center program. Example, start cooking, painting, dance classes, or yoga classes, or a bridge club. Anything, as long as you're there with other people around you. Plan to meet a family member or a friend every day for tea or coffee in a public setting. Invite a few friends over for a potluck dinner. Go to a park, sit and watch people go by, and perhaps say hi to a few strangers. In addition to social activities, the next best thing that releases natural opioids is social touching. Skin-to-skin contact has been shown to be pretty important for healthy mental, emotional, and physical well-being in animals, newborn infants, children, and adults. Endogenous or natural opioids are released when a social touch is not threatening, pleasing, and not necessarily sexual. Perhaps those who are deprived of adequate and frequent social touch are at a greater risk of dependency on pain medications, as they lack the regular production of natural opioids. The positive emotions and feelings associated with natural opioids are so strong that the body will desperately crave social touching for its survival. To stimulate natural opioids and perhaps reduce the need for pain medications, you may consider getting a daily dose of pleasurable physical contact. You may hug people you meet, if appropriate and, of course, consensual. Regularly hug family and the people you love. Hold someone's hand for 1 minute. With love, hold the hand of a child or a senior. It makes no difference. Participate in safe, consensual physical intimacy. Or you may even stroke and hug your dog or cat whom you love. If for some reason you're not able to participate in any physical or social activities every day, you can still give yourself a dose of natural opioids by simply listening to pleasurable music. The benefits may be due to several factors such as distraction, relaxation, and pleasure from the natural opioids released. The benefits of music may be seen within 2 weeks, so it's recommended that you actively listen to 20 to 60 minutes of 1 to 2 daily music sessions for at least 14 days. So do your best to mindfully listen to 20 to 60 minutes of music that you enjoy with headphones, with full concentration every day. Have pleasant music in the background while cooking, cleaning, or before bedtime. Put music on and sing in the shower every day. Join a choir if that's your thing. You don't even have to be a good singer to release endorphins. In summary, you now know about the possibility of opioid-induced hyperalgesia, or OIH, which was more nerve hypersensitivity caused by artificial opioids taken for a long time. If you've been on pain medications for a long time, discuss with your doctor how you wish to wean off them and follow the advice of your physician. To gradually reduce the need for pain medications, you must focus on your body releasing your own natural opioids. This can be done by getting involved with daily physical exercise or just life activities. Socialize, laugh, experience physical touch, and enjoy music. Even if pain is not immediately reduced, getting involved in small, enjoyable life activities is guaranteed to improve the quality of life for you and those around you. In the words of Oscar Wilde, "I don't mind pain, so long as it doesn't hurt." Go ahead, smile, and release your opioids by enjoying the small things in life. Then the pain won't hurt as much.